What is your body? Hello everyone. Today, I want to tell you a story. It's a story in my life that was deeply personal, confusing, and even a little frightening. It happened during the height of the COVID-19 pandemic, and I was living in Hawaii. Going back home to Korea wasn't an option. Travel restrictions, quarantine requirements, and so much uncertainty made it nearly impossible. So, I stayed. In many ways, Hawaii felt safer than home. So I continued my studies and tried to keep a routine and just kept going. My life was strange, but manageable. Then, one evening, after spending time in the ocean just steps from where I lived, I came back home feeling a little off. At first, I thought it was just fatigue or maybe just a cold. But the feeling didn't go away. In fact, it got worse. So I started visiting hospitals in the area hoping for answers, but each time the same thing. Normal tests, no clear diagnosis, and no real explanation. And that was when the real struggle began, not just physically, but emotionally. Being sick in a foreign country, far from family, with no familiar languages or support system, it was isolating. And I felt invisible, not just misunderstood, but truly unseen. And I started questioning everything. What if the medicine can't explain what's happening inside you? When the system says you're fine, you know you're not. I began to wonder, what if there's a better way? What if the medicine could see me not just as a case, but as a whole person? And that question had led me to something called personalized precision medicine. And also that question has taken me on a journey. And what I found was that we're in the middle of a quiet revolution of healthcare, which is called precision medicine. Unlike traditional medicine, which often starts with the one-size-fits-most approach, the precision medicine begins with the individual. It asks, who are you? What's your biology? What's your habits? Your environment? Instead of asking what will work for most people, the precision medicine asks what will work best for you. And this transformation is possible thanks to a growing field called the multiomics. I know it's mouthful, but it's powerful. It means not just looking at your DNA, but your RNA, your proteins, your metabolism, everything all at once. It's like going from looking at one puzzle piece to seeing the entire picture of your body. And this isn't a distant dream. It's already happening. In South Korea, for example, the Ministry of Health and Welfare is developing a national precision medicine cohort. They're gathering real-time data from 100,000 individuals, include genetic informations, lifestyle data, and environmental exposures, all to create treatments that isn't just based on averages, but on real diverse people. They're also building a digital infrastructure to make it clear. Platforms that connect hospitals, researchers, and biotech companies in real life. So, imagine walking into a hospital and your medical team already knows what treatment will work for you, not just based on your symptoms, but on your body, your genes. Let me give you some example. There's a Korean patient, let's call him Minsu, was diagnosed with lung cancer. In the past, it might have meant standard chemotherapy, but the doctors ran genetic tests and found a mutation in the EGFR gene. Thanks to the single insight, Minsu received targeted therapy and his condition improved dramatically. And that's the power of being seen, not just as a number, but as a person. In other cases, researchers identified rare inherited eye diseases in patients who have spent years searching for answers. Some received targeted therapy, and others found in peace in simply knowing what they were living with. And this is where precision medicine begins. People who ask, there has to be a better way. And it grows through technology, data, AI, and global collaboration to build a healthcare system that truly serves individuals. So, imagine this: a world where treatment isn't based on general statistics, but on you and your story. And this isn't a science fiction, that's where we're headed. There's a novel called Autonomous. There's a character, Jack, a chemist, who illegally reverse engineers patented drugs to make affordable versions for the public. And her story raises a powerful question: who gets access to life-saving medicine and who doesn't? In our society, even with all the advances, the access to precision medicine is limited, often by cost, geography, or bureaucracy. But the precision medicine offers a path toward more equitable healthcare, and implies us that this isn't only for the privileged few. And that means protecting data privacy. That means creating an ethical system, and that means putting people before profit. Because the future of medicine isn't only about treating diseases, it's about understanding the individual. And one day soon, someone like me, lost, scared, and feeling invisible in a foreign country, will walk into a hospital and feel seen. Not just as a patient, but as me, myself, a whole person. Thank you.